So just shoot
Hi,
away.
everyone. Thank you so much for being here today. Thank you for being patient. I know we're starting a little bit later, just a few minutes, right? We're on Latin time, just a few minutes later than we said we would. I have a very, very special guest with me today, Dr. Hernandez from Chapala Med, who's going to be answering some of our most pressing questions regarding medical care in Mexico. If you guys are new around here, my name is Mariana. This is Mexico Relocation Guide, and we are your expert guide to living and retiring in Mexico the right way. In the comments section, I included a free living in Mexico guide for expat. It has a lot of information, just preliminary information for you guys to decide if Mexico is right for you, because I know a lot of you guys are still in the research phase, which is why I thought it would be great to bring on Dr. Hernandez today to talk to us about medical care in Mexico, and particularly Chapala Med in the Lake Chapala area. So, Dr. Hernandez, thank you so much for being here today.
No, thank you for the invitation.
Yeah. Why don't you start off and tell people just a little bit about yourself, just some background?
Sure. I was born in Mexico in the state of Michoacan, and I actually grew up in the Chicagoland area. I never actually thought about moving or relocating back to Mexico until I came to medical school here. I have my undergraduate degree in pre-med biology and Spanish from Indiana University. I came here into Guadalajara for medical school at Universidad Autónoma de Guadalajara. I
Mm-hmm.
went back to the Chicagoland area and did my postgraduate training in family medicine. And I worked there until from 2006 to 2012. At the end of 2012, I relocated here to Guadalajara in the Lake Chapala area, and I opened my practice called Chapala Med, and it's been going. It's been growing ever since then. We're almost in operation for 10 years. It'll be 10 years November 5th.
That's great. Congratulations for that. If
Thank
you
you.
guys don't know about Dr. Hernandez's practice, it's again Chapala Med. You can find them online on Facebook at facebook.com/Chapala Med or chapalamed.com. And they have a variety of different specialists, everything from oncology to heart conditions to, I mean, really a lot of different specialists, which is really something that is beneficial to you. It's kind of like your one-stop shop for everything. And right now you guys are only in Guadalajara and Lake Chapala, am I right?
That's correct. In the future, hopefully this year, we look to expand to like San Miguel de Allende. We look to serve the expat population, um, which generally encompasses the geriatric population. It's expats or retirees who move to Mexico. But in the last 2 years, ever since actually the pandemic has started and people are doing more home office, I found that people in their 40s and 50s are moving to Mexico.
Yeah, the demographic is really changing, especially people being able to work from home. And you're right, COVID maybe kind of gave somebody, a deeper look into life, and really realizing, like, is this what I want to do for the rest of my life? It just kind of gave us a chance to pause and reevaluate. So I really think that the demographic of people moving to Mexico is changing. It's definitely some younger people now, which is really great to see.
That's correct.
Yeah. So for you guys who are watching at home, thank you so much for being here. I see your comments popping in. Don't worry, I'm going to get to your questions. I want you to go ahead and start asking your questions, but I do have some topics that I want to cover with Dr. Hernandez first. Um, Dr. Hernandez, I would love for you to tell our audience, if you could just give us a background as to how do doctors differ in Mexico? Like, if I'm a brand newcomer to Mexico, I've never gotten medical treatment there before. Is there a way for me to better pick my doctor rather than just going online and finding, Google reviews and things like that? What's your recommendation?
Well, actually, the Google reviews here are more a newer, more novel way to find a doctor, a referral. Um, what you want to do actually is interview a doctor just as you would anybody for for a job. If you're going to hire a lawyer or an accountant, you want to make sure that they have the proper credentials. Um, I would say the big difference for doctors in Mexico versus US or Canada is that the age. In order for a person to become a doctor in the United States, you have to have an undergraduate degree at least, or finish your pre-med requirements. In Mexico, you could actually jump straight from high school into medical school, so you don't have that degree under your belt. Doctors here, general practitioners, are usually graduating from medical school at the age of 22 or 23. Whereas in the United States, it's on average, I'd say a doctor is graduating from medical school maybe at the age of 28 or 30. And they don't actually start practicing or making money until they're well into their 40s after all their postgraduate training, which we call residency. Here, a lot of the doctors finish their residency training by the age of 26. So it's surprising to see some of the specialists to look very young. Now, there are pros and cons to each system. In the United States, I would say the greater advantage of somebody who is a physician is that they tend to be more mature. Okay,
Mm.
they have a different outlook on life, and they have more experience. Especially the undergraduate degrees, get you a feel, of general social issues and things like that. Here, they do not focus that much on that. In the United States, having an undergraduate degree makes you familiar with a great variety of people from different walks of life,
Mhm.
different experiences. In Mexico, we don't have, for example, a lot of people with what we would consider Afro-American descent, and it's just used. It's generally monolithic, so to speak. It's or monocultural. Whereas in the United States, we have to take into account a lot of different norms, social norms. For example, when we treat patients from ethnic backgrounds such as Asian backgrounds, um, Afro-American backgrounds, Latino backgrounds. Each one of those different cultures has a lot of different types of pathologies or diseases. In Mexico, they tend to kind of overlook that. So, if you are, for example, an African American who's looking to move to Mexico, you definitely want to have a doctor who not only speaks English, but also is culturally sensitive. So you have two things you have to overcome: not only the language barrier, but also the cultural barrier. So, in looking for a doctor, it would be very important that you find somebody who has also this cultural competency.
Yeah, great point. I hadn't considered that. And you have to have familiarity with some of the diseases that are more predominantly usual, right, in certain races and others. So yeah, I hadn't considered that.
Correct.
Yeah. Um, Now, what are your thoughts for somebody who, would be coming to Mexico maybe for the very first time? They're not going to be living in the Lake Chapala area, but they might want to consult with you initially just to kind of get an idea of, are they going to be able to continue their therapies, or are they going to be able to get their medications in Mexico? And you would be able to know that, or somebody in your staff, right? One of your specialist doctors would be able to know that at Chapala Med. Do you guys offer telemedicine?
Yes, we do. We do have telemedicine, those virtual consultations, and we actually did have them prior to the pandemic.
Mhm.
Um, but obviously, we had to use that avenue for consultations during the pandemic a lot more. Now, the nice thing about that is actually you could set up a consultation, and it could be a virtual meet and greet type of meeting with your doctor, an interview.
Mhm.
And an important to answer your question about medications, it's really important that you first go see your doctor, your primary care physician or specialist in the States or in Canada prior to moving to Mexico, and saying, and then, getting your list of medications updated and see if those medications are available here. I would say about 90% of the medications in the US are available here in Mexico. And if not, there is a viable alternative that you could use here. And again, that would be up to your current primary care doctor and yourself whether or not you want to switch over to the other medication that's available here in Mexico. When in the event that there aren't any of those medications available here in Mexico, what a lot of people do is, they order maybe a 6-month supply, and they have it shipped to Texas or some border town, and they have somebody go up and pick them up and bring them down. You can't legally mail medications to Mexico. That's a very important point.
Yeah. So if anybody tells you out there that they can mail your medications to you to Mexico, it's actually inaccurate. And there is a really good forum on Facebook called the Mexico Mule.
Yes.
Right. And that's a great way for you to ask somebody for a favor who may be coming from whatever town you got your medication shipped to in the US or Canada, and is going to be flying or traveling to Mexico anyway, if they could do you the favor of bringing that medication with them. Have you seen any problems with people doing that if the medication isn't for them, like if the prescription isn't prescribed to them?
I hate to say that, but there's a lot of informality here.
Yeah.
Some patients do have medications, get medications in another person's name and take them. It's just something you kind of have to accept. The medications that absolutely need prescriptions are antibiotics, some certain sedative hypnotics, like the sleep aids, or some opioid medications like pain medications. Most other medications, you can actually get them over the counter without a prescription, like high blood pressure medications, diabetes medications, things like that. You don't have to actually worry about getting a script or having it in another person's name. Again, there are pros and cons to this system. The pros are, for the patient, it's easy for them to get their medications without having to see their doctor. But the con is, from the medical point of view, from the healthcare provider point of view, is you don't have oversight. You aren't monitoring the patients, and you're not able to see whether or not they may be underdosing, overdosing on certain medications, or they're maybe having some side effects of those meds. So it's important, even though you could get like high blood pressure medication over the counter, to see your doctor regularly.
Yeah. People, be careful of self-medicating yourself. Even if you know that medication is safe and you've taken it before, I completely agree with Dr. Hernandez. Just double check with your primary care physician in Mexico to ensure that you're not having an adverse reaction to something that you're getting over the counter in Mexico. Or maybe it's having, a reaction with something else that you may be taking for another condition. So yes, I totally agree with you, Dr. Hernandez. It's a benefit, but it can be dangerous if you don't do it the right way. What about doctoralia.com.mx? It's a website for those of you that are watching that don't know what this is. It's a website you can go to. It's kind of like the Google, right, for doctors in Mexico, and it gives you reviews and it shows you times that they're available for you to book a consult with. It also tells you if they offer telemedicine and the specialty that they specialize in. But what about you, Dr. Hernandez? How do you feel about that website to maybe do some research?
Dr. Alia is focused for the national consumer, for the national patient, actually. All the reviews and things tend to be in Spanish.
Mm-hmm.
Okay? I am on that platform, and I do get a good number of referrals from them. But I do it mainly to try to focus and require Mexican patients. I think the expat population would be better served by using just regular Google reviews or
Okay.
Yelp. I actually just attended a medical tourism conference, and the one of the speakers actually mentioned and emphasized the importance of using Yelp. There were well over 1,000 doctors in attendance from all of Mexico at this medical tourism conference. The
Mhm.
nice thing about Yelp is that um, it's not managed by like the healthcare provider or the restaurants or anything like that, and they tend to vet the person who is doing the review, whereas Dr. Alia does not vet who is writing those reviews. Google
Mm.
also, you have to have a Google account in order to write a review. That's one way that you could see who's writing it, a review, and make sure that it's not an anonymous review. Now, when reading reviews for a patient, you have to be very careful. Uh, yes, a lot of people do recommend doctors based on, let's say, their bedside manner, their people skills, and not so much on their resume.
Mhm.
Uh, Certain specialties, you require somebody with a good deal of training, a very good, solid knowledge base. Here in Mexico, there are once you graduate medical school, you become a GP, and you could open shop, rent out a little office space. But you do not have postgraduate training. You do not. These general practitioners have only passed what's called a professional exam given to them by their universities. And quite honestly, those aren't the best caliber or litmus test a for the for the knowledge base of a doctor. The medical board exams here called the NARM, I think they're a very good litmus test, so to speak, and you need those to get into a medical specialty for a residency program. They are akin to the USMLE, to the board exams in the United States. Now, those exams are extremely difficult, and I think in order for a residency program to accept you into their program, you have to score very high on those exams. So, getting back to the point is whether Dr. Alia has those or not. Dr. Alia does ask physicians who set up those profiles on their platform to post some of their credentials and their CVs, their resumes, and I think that's a very good part of that. But again, this is controlled mostly by the healthcare providers. And if you get on Yelp, again, those are not controlled by the healthcare providers. So if you have a bad review or something like that, it's hard for the healthcare provider to get rid of those.
Yeah, great point. I hadn't even considered about using Yelp in Mexico to find a doctor because I feel like Yelp is such a USA and maybe
Mhm.
Canada thing, that I know that it's not really adopted in Mexico. But I hadn't even considered that it could be adopted by foreigners living in Mexico, to
Yeah.
review doctors and medical facilities. So great tip.
Mexicans per se, I'm sorry to interrupt, but Mexicans per se do not use Yelp so much. They're not very familiar. That was a point I brought up at the medical conference that I talked about. But for expats, I think it's a really good resource, not only for medical care, but for so many other things.
Yeah, great point. So everybody out there, if you're watching and you're wondering, um, you can go ahead and, I mean, just use that as part of your research, right? Do your full due diligence. Like Dr. Hernandez said, find out how long your doctor has been practicing. Certain specialties, obviously, that require a very strenuous type of training. So find out and just make sure, obviously, take your medical condition into your own hands. And a lot of expats, Dr. Hernandez, as I'm sure you're aware, come to Mexico and they just think, well, I'm healthy now. I'm just gonna pay out of pocket. I'm not gonna get healthcare insurance until something, really maybe expensive happens or catastrophic happens. So I'd love to know your thoughts about people, like you mentioned, the demographic is changing. So people are moving to Mexico. They may be younger now, and they're thinking, nobody thinks they're going to get sick, right? So I'd love to know your input on self-paying versus having healthcare insurance, and why having healthcare insurance may be important.
Well, this is one very broad topic, and I actually do. There's another program here in the IHEC area, which they sponsor kind of like a week long crash course on moving to Mexico, and this is a day long topic: medical insurance. I don't give that particular talk because healthcare policies they change quite a bit. But I will say this: I recommend that if you do come to Mexico, even as a tourist, you do have healthcare insurance. You could check and see if your U.S. medical insurance has uh, um, overseas policy. Okay, that's really important. That'll save you a lot of headaches. Now,
Mm-hmm.
there aren't any medical insurances, national, Mexican. When I say national, I mean Mexican, or um, or foreign policies from the U.S. or Europe that cover primary care. A lot of patients, in the U.S., we're used to your medical insurance covering your primary care office visits, and you have a copay or a deductible of $20 or $40, whatever. Here, that's not the case. But what you can do is you could use whatever you're paying, and you could get receipts, and that will go down, count towards your deductible for the given year. Now, if you do end up moving here permanently, if that's your plan, I would say at least get into the national healthcare system called Seguro Popular. Here in Mexico, one nice thing, at least on paper, it is a right for every Mexican to have access to the public healthcare system. So if you get your visa, your temporal, you qualify already for the Seguro Popular. Okay, I think it goes by another name now, the INSABI,
And savvy.
INSABI,
Yeah.
the
Mm-hmm.
Institute of Health and Well-being. Okay, but that is a very good, I would say, net for people to have if you have a major car accident or need some catastrophic type of care. That healthcare system has what you need, maybe not what you want. Now, if you get a Mexican private healthcare insurance policy, such as MetLife, New York Life, GNP, Plan Seguro. Those are just a few of the companies that give healthcare insurance policies here. You will be able to have access to uh, the private hospital or healthcare system. And a lot of these hospitals, they do tend to speak English. Now, there are different levels, obviously. In Guadalajara, we have very prominent and very modern facilities such as the Hospital San Javier, um, Hospital Real San Jose, and the Puerta de Hierro hospitals. I'm actually on staff at the Puerta de Hierro hospitals, and the nice thing about that hospital is they have a um, partnership with the Mayo Clinic in the
Mm-hmm.
United States. So for people who need or want a second opinion from the United States, then we know that that's accessible to them, and it's also covered by those health insurance policies uh, that are taken by those Puerta de Hierro hospitals or the other private hospitals. So definitely get yourself on one of those policies. And the best way to find out more about these is to contact insurance agents.
Of course, yeah. Somebody who is knowledgeable about the different tiers of hospitals and what coverages you have, and
Mhm.
someone in Mexico that's knowledgeable about the procedures in Mexico.
Correct.
What about, some people always have a question of like, I understand that medical care is more inexpensive in Mexico, right? For like outpatient things like having lab work done, having certain procedures done. But the more costly things can be things that need to be treated on an ongoing basis, like chronic diseases, cancers, maybe even diabetes, things like that. Um, would you be able to share? And I know that this is obviously a generality. We can't actually say like this is exactly what it's going to cost you. But if I did have diabetes and I wanted to manage my diabetes, and I know there's different types of diabetes too in Mexico, what could be some out-of-pocket expenses if people didn't have insurance that they might need to consider? Is that something that you might be able to share?
Well, sure. Uh, Diabetes is a very good example, I think, that for us to use for this question. Now, diabetes is usually managed on an outpatient basis with your primary care doctor, which is not covered by insurance. Okay, so even your medications will not be covered by insurance. Okay, again, you can use those costs, save all your receipts and use them towards your deductible. Now, regular office visit, for example, and I charge the equivalent of 45 US dollars for an office visit. In the United States, when I worked up in the Chicagoland area, an office visit with our GP at the office I was working at was about $100. So right off the bat, you're saving quite a bit of money.
Mhm.
Now, everything is, how can I put it? You have added value here when you see me. And I haven't increased my prices, on the 10 years that I've been in practice. But, you can see a doctor here for as little as $4 or $5.
Mhm.
There are doc in the box type of operations or practices that are attached to pharmacies, for example. Like Farmacias Similares, they'll have a little office with a doctor, one of these GPs, and they'll charge the equivalent of 40, 50 pesos, which is $2, $3. And sometimes they don't even call them medical consults, they call it medical orientation.
Mm.
These doctors, they tend to make their money, their living, by prescribing the medications in that pharmacy. And
Obviously,
that's
yeah.
kind of a conflict of interest. That business model would be unethical in the United States
Mhm.
for a lot of reasons, but here it's a normal method of operation here.
Mhm.
So again, you can see where these medical costs are a lot less just for seeing a doctor. And this doctor does not need to be your primary care doctor, but I recommend that you do establish yourself with a primary care doctor. Now, something like having a heart attack, which diabetics also, suffer from,
Mhm.
actually, cardiac diseases is the most common cause of death and illness in diabetics. So again, this is another a good example to answer your question. If you were to get an angioplasty or go to the cardiac cath lab to get a stent, you're looking at spending about $15,000 to $20,000 US. That procedure, I know, for example, in the Chicagoland area, will cost you or your insurance company well in excess of $100,000. So you see that it's quite a big difference. Now, if you're looking to insure, self-insure, I would say you need to save at least $20,000 to $30,000 US for some of these major medical emergencies, so to speak.
Yeah. Great advice. Yeah, just at least have that money set aside for a medical emergency if you plan to not have medical insurance. And why is that, Dr. Hernandez? A lot of people don't realize that you can actually um, not be denied medical attention, but it can be very hard to then get released from the hospital, or just it can be a bad experience if you don't have the funds to pay the hospital. So a lot of people don't know this, and they find out maybe, unfortunately, the hard way, and then they're asking friends, family, neighbors, anybody to chip in and help them pay for their medical cost. So
Yeah,
why is that? There's nothing really. There's no. I guess there's no really third party involved that can go after these, people who haven't paid, as far as like credit and things like that.
Well, unfortunately, I've encountered quite a few of these situations in my own practice with my own patients, and I've heard quite a few of them. Again, this is why it's important, number one, for you, the patients or the prospective expats to get into the public healthcare system if they live on a fixed income. I know a lot of retirees here live on a couple $1,000s. In the
Hmm.
US, you can't really live off of that, but here in Mexico, you should actually live pretty well on $2,000 a month. But if you have a major medical emergency, then those $2,000 obviously are not going to quite help you get the health care that you want. That's one of the most important points I want to stress here. Um, most expats can have access to good health care. It may not be what they want, but it will be what they need. So what does that mean? So a lot of these patients who run into these situations where they have to go into a hospital and they undergo, maybe they're having a heart attack, they have a stent or a pacemaker placed, and they're looking at paying $15,000, that's their hospital bill. And here in Mexico, when you get hospitalized, the hospitals usually ask you for a deposit up front. If you are going in for medical care, it's usually like 100,000 pesos. They may ask you anywhere between 5,000 US dollars to 10,000 US dollars if you need a surgery.
Hmm.
Now, if you are looking to get discharged and you don't have the money, one of the ploys or the strategies that the hospitals tend to use is not to let you leave, or
Right.
they have you sign a promissory notes,
Hmm.
and where you may leave and guarantee some assets that you may have, some properties. And I've even known people to give their pink slip, or what we call the factura, for a car,
Hmm.
guarantee of payments. Um, Unfortunately, a lot of hospitals have had these situations with expats, and with and also with regular national patients who just they get the best of care, so to speak, and they skip out on their bill. That's unfortunate because even the doctors who may be taking care of you don't end up getting paid. That
Yeah.
that's sad. So if you're on the receiving end, that maybe for whatever reason you don't have access to your money, your credit cards, you can't pay, I would say contact a lawyer. There are a couple of lawyers that I have worked with, and have helped. I've been an advocate for my patient. For me, the most important thing um, is that the patient get the adequate health care that they need. And if they've come into the situation where they, for whatever reason, if they have the money or not, they can't access their bank accounts, then I recommend that they contact the lawyer. The lawyer will mediate some type of deal where they'll be able to discharge the patient. In some extreme cases, I've actually had to vouch for my patients, and talk to the hospital administration where they say,
Mm.
"Look, I had a patient who passed away, and the spouse of the patient didn't have money or access to those bank accounts," and say, "Hey, look, they're good for their money." And if the doctor has a very good relationship with the hospital, then that's something you want to explore when you also talk to or interview your doctor, that in a given situation they would be able to vouch for you, and you may not even need to contact the lawyer or hire a lawyer to get you released from the hospital.
Yeah. Wow, great tips. Yeah, and yeah, exactly. Definitely interview your doctor first of all, but also great tip. I mean, make sure that one, they have a good relationship in in the hospital that they practice in,
Mhm.
because it could end up being a situation like this in the future, where maybe even they might have a colleague that you might need to see a specialist that is not them, and they might be able to vouch for you if you didn't have the funds available to you right away.
It is important. For example, I've known of one doctor who's a surgical oncologist, an oncological surgeon. He performs, very, very expensive surgeries for cancer patients. He's had the doors closed to him. He has no privileges at a number of hospitals because he takes on these high risk cases, and unfortunately, they don't pay. And so after hundreds of thousands of dollars that those hospitals are out, they say, well, they're all at the root of these losses is a given doctor. So that might not be something that most physicians are willing to share, but you
Sure.
can easily call the hospitals and ask them, ask the hospitals if your given physician has privileges.
Good to know. I'm going to take some questions because I see a lot of questions coming through. So you ready for some questions, Dr. Hernandez?
Of course.
Great. So first of all, people are just very, very, very glad that you're doing this. Lots of appreciation in the comments. So I want you to know that. Let me see some questions here. So Sherry has a question, I think. Let me read this out loud. From my boyfriend, Brett, I had open heart surgery and need a yearly echocardiogram
Mhm.
and follow-up visits. Would this be considered a pre-existing condition? Oh, we haven't covered why pre-existing conditions aren't usually covered by insurance companies in Mexico. But if you're new to this channel and you're just now popping in, usually pre-existing conditions are not covered for most Mexican policies. In some rare cases, they may cover them, and then your premium may go up substantially. But to this person's credit, would this be considered a pre-existing condition?
Yes, it would be a pre-existing condition. Again, you have to shop around for uh, healthcare policies, healthcare insurance policies. Some of them may give you a year as a certain disease or diseases related to an underlying condition or pre-existing where they won't be covered. So if you've had a heart attack or something like that, maybe anything related to the circulatory system may not be covered for a year. So yeah, it would be a pre-existing condition. But if you get an echocardiogram here, usually in Mexico they range about one at the most $200. So it's accessible to most people.
Yeah, I hope that answers your question, Sherry. And thank you, Dr. Hernandez, for addressing that.
Mhm.
There's another question here. So she'd love to know if, and I mean, Dr. Hernandez is not an insurance broker, but he does know the healthcare world really well in
Mhm.
Mexico. So just keep that in mind, everyone. Please enlighten us on the difficulty of getting private insurance over the age of 70. Because it's hard in Mexico to get insurance over the age of 70.
That is correct. This is something you want to consider before moving to Mexico. I would encourage most people to move to Mexico before they reach the age of 70, because most healthcare insurance policies they have a cutoff age where they will no longer insure you. In Mexico, in the United States, fortunately, even though some people don't like to acknowledge this, but there are there are laws that really help benefit the patient. Whereas here, they tend to favor larger companies. That's kind of odd to think about it when you think about it, but that tends to be the case. So yeah, at the age of 70, what you probably would be in line for would be you a foreign medical insurance policy. There are a couple companies like VUMI or Best Doctors that do provide coverage for patients over the age of 70.
What about IMSS, Dr. Hernandez? How do you feel about IMSS?
IMSS, you do have to apply to be accepted into that program. Um, and you usually have to go to the local IMSS clinics,
Mm-hmm.
and they have an intake doctor and intake nurse who you do have to basically fit the profile for them. You have to provide um, proof that you live here legally, and again over a certain age. Most people get IMSS if they work here,
Mm-hmm.
or they can actually buy into it.
But that is
Okay.
an option for somebody who's over the age of 70 and might not be able to get covered for anything in other insurance companies if they deem them to be too high risk for them to take them on. Now, I know IMSS also excludes pre-existing conditions. And
Yes,
sometimes
they
they have waiting periods. Like, for example, you can't, they won't cover pregnancies, for example, for the first 2 years, or
do.
certain heart conditions for the first 3 years, things like that.
And
Um,
that's why the INSABI, or what was known as Seguro Popular, that would be the safety net for those patients who are over the age of 70.
okay, good to know it. So we have a question regarding medications. I will need to obtain Lamotrigine, Coreg, and Cosar in Mexico. I assume these require a prescription. Would I be able to obtain them through a clinic attached to a pharmacy? Is this common in Yucatan? Well, he's not in Yucatan, but maybe you can shed some light in what is common in Jalisco.
Um, the tip, if you want to know if a medication is available here, you could log into the Mexico's version of the PDR Physician's Desk Reference. Here it's called a PLM. Okay, so you could do a Google search, type in that medication, like let's say Cozar, and put PLM afterwards. All right, Cozar PLM, and then it'll give you the generic name for it, and the brand name, etc. So this is something you could do prior to moving to Mexico, and also if it doesn't come up on the PLM website here, that's something you should address with your doctor prior to coming down to Mexico.
I put it up on the screen in case you guys are wondering how to spell that. And I just did a quick Google search for
Mhm.
PLM Medicamentos Mexico. And this is the site that came up. So I'm not sure if this is the one that you're referring to, Dr. Hernandez.
Uh-huh. Yes, it is.
Oh, sorry.
PLM. Mhm.
Okay. Well, then check out PLM. Another tip that I can give you that I have found to be really useful is to go to Farmacia del Ahorro, which is,
Mhm.
I'll put it up on the screen also. Now, you do need to know the generic name of your drug or your medication to find out if they carry it at a pharmacy. It gives you pricing, gives you the different dosages, and tells you where it's available, like in what pharmacy. So I have found that to be really helpful, but you do need to know what the generic name of your medication is to do just kind of a quick check before moving to Mexico.
Farmacias de la Hora is a chain of pharmacies. One that I actually am a little bit more inclined to use is Farmacias Especializadas.
Farmacia.
FESA, FESA, Farmacias Especializadas. The nice thing about that pharmacy chain is that, you know, the medications may be available in Mexico, but it doesn't necessarily mean that the uh, pharmacy will have them on hand or have them in stock. For example, a lot of the opioid pain medications here locally, Lakeside, they're not available. Actually, only specialty pharmacies in Guad have them, or like this one. You could type in the name and see if it's available in Mexico and at what branch or what store it's available. And if it's not available locally, they could actually ship it in from another state,
Mm-hmm.
and they could even deliver it to your house.
There you go. So if you happen to find it in Jalisco and you lived in Yucatan, you could have it. I mean, within the country, you can ship medications, just not internationally, is what you're saying.
Correct.
Yeah. So a lot of you guys have questions regarding medications and is this medication available and will I be able to get it? And I would say again, follow Dr. Hernandez's advice. First, go to the website that I just posted in the comments, medicamentospLM.com. Find out what the generic name of your medication is first. Two, you could always consult with a physician before moving to Mexico and find out directly from them, right, or a specialist before you move to Mexico. Make sure that they offer telemedicine, and you can find out what your medication is in Mexico, if you can get a prescription there, and then the dosages that you need to look out for. And then you can start establishing that relationship too before you move. I highly recommend Chapala Med. Even if you're not going to be moving to Lake Chapala, they do offer telemedicine, so I highly recommend them. And they're very, very, very reputable and highly, highly reviewed.
Thank you very much.
Yeah, absolutely.
I know there are, I see quite a few questions that I didn't address, but if, depending on the time span, if we run out of time, you could shoot me an email at info@chapalamed.com, and I'll be happy to get back to you with those more specific questions, answers to those questions.
I put it in the comments for you guys. I also want to share his Facebook page, or Chapala Med's Facebook page. And then I'm also going to share Chapala Med's website. So definitely go check that out. Specific cancers, people with specific maybe blood type cancers, do you guys have hematologists on site that might be able to consult with them?
Yes, we do. There are a few specialties which are, there are very few specialists. Hematology is one of them. In Guadalajara, there are only a handful of those specialists. I am very happy to say that I work with one of the most prominent hematologists in this side of the country. Her name is Dr. Lluvia Sosa. She's the director of the blood bank at the Centro Médico in Guadalajara. She's very gifted and bright young doctor. So that is really her specialty. I was even impressed when she actually cured one of my patients with multiple myeloma, which is almost a death sentence. And again, she's on par with any doctor, with Harvard education, etc. I mean, the level of care that you could receive here is just impressive. It continues to impress me every day.
What is her name again? This is specifically for somebody who asked
Dr.
me.
Lluvia Sosa. Lluvia like rain. Sosa.
SOSA?
Mm-hmm.
Okay. So Eric, go check out Dr. Lluvia Sosa and consult with her, please. You have a straight recommendation from one of the top doctors in Lake Chapala. All right, I'm going to take just a few more questions because I want to be very mindful of Dr. Hernandez's time, of his very valuable time for spending the afternoon with us. And thank you guys for being here. As he mentioned, he has an email address that he's offering you guys to answer some more of your questions. This is a great one that doesn't come up very often, and that is long-term care and assisted living options in Mexico. Now, I know about La Pueblita in right outside of Ajijic, but perhaps you can shed some light into what options people have in maybe Guadalajara or somewhere else.
Well, La Pueblita is basically a newer, it's a newer community. It's based on a U.S. assisted living care model. One thing that is very different culturally in Mexico versus the U.S., and I would say this holds true for a lot of other, I guess, up and coming countries. I don't want to say third world. For example, India. India has a lot of very similar cultural norms to Mexican society, where we view that that it's frowned upon if you stick your elderly or your grandma, grandpa, mom, and dad into assisted living or like that. It's frowned upon. Here, it's the cultural norm to take care of your own mother, father, grandparents. So it's very normal for to have a household with 3 generations, if not 4, living under the same roof.
Mm-hmm.
But that being said, there is an increased amount of need for these this type of care, especially with people like with dementia. Now, Mexico's economy is very up and coming, especially like in Guadalajara. It's taking after a lot of what most modern cities in the U.S. the same rat race, and they don't have time to take care of somebody with some chronic diseases or something like serious as like dementia or Alzheimer's. And I think La Pueblita here is one of the best, um, has the best infrastructure for this assisted living. They have areas with different degrees of care. Some it's just basically a little gated community, and you don't. It's an area where they have an area where you do not need any care. Then they have an area for people with dementia. Then another area where somebody needs round the clock care, so to speak. And it's on a different tier system, much like in the US. There are about 10 to 15 other nursing homes, I'll put it as that, and they are in essence just homes that have been converted into an assisted living unit. I mean, it's not like in the U.S. that it looks like a medical facility or building, but these are homes that have been gutted out. They may have about 10 to 12 bedrooms, and they've been adapted to provide care for the elderly, for senior citizens.
Yeah, I would kind of second what Dr. Hernandez said. It's very common in Mexico for you to have an elderly parent living at home. But what happens if both of you are working, or maybe you're alone and you don't have kids, and you're taking care for your spouse by yourself, and maybe you're not strong enough to help them take baths and things like that. So in Mexico, it's actually very common to have a live-in nurse, or somebody that comes maybe part-time and spends a few hours every day helping you from everything from administering drugs to injections to helping your patient take a bath, et cetera, right? And they seem to be very accessible, especially when you compare it to assisted living facilities in the U.S., which can be thousands and thousands of dollars a month, and not covering medications. So anyway, long story short, that's also something that's very common. Now, the thing is, with a live-in nurse, it may be also unusual for them to be bilingual, right, Dr. Hernandez?
That is true.
Yeah.
And in the city in Guadalajara, you most likely will not have bilingual healthcare providers. Here, the lakeside area, or maybe somewhere like San Miguel de Allende, where you do have a large expat population, there are these nursing homes or assisted living facilities that do tend to cater to the expats, and they have bilingual healthcare providers. Okay. One thing that you definitely need to investigate as well before you check into one of these places or send a family friend or a loved one is the credentials of those people providing care. Um, in Mexico, a lot of people, I would say that this area, this industry is highly unregulated. So a lot of people just tend to open shop without getting all the appropriate um, infrastructure. You need to have a nursing home that has a doctor as its médico responsable. Okay, that's one important thing. The other thing is that they should have at least one nurse on staff round the clock. A lot of these places do not. They tend to hire people who have very limited training in providing appropriate or professional care to elderly patients, and that's one of my major concerns that I've seen at some of these nursing homes. That people, for whatever reason, maybe they were the maids or gardeners of an expat and kind of fell into that role of providing care.
Caretaker, yeah.
Yeah, the caretaker, and then their boss passes away, and they say, "Hey, I know how to take care of so and so," and they get hired at with some of these nursing homes. It's deficient, because the level of expertise obviously is not professional. Um, I can't say that I can't say that they do not care for the patients
Sure.
emotionally, but you need not only to have um, emotional care, but you also need to be able to care for these with at least a decent background in medical healthcare.
Yeah, there's a reason why there's training, right, for nursing and doctors. You need to be able to tell the signs before the real problem starts. Um, so good advice, Dr. Hernandez. I have one more question, and then I'm gonna let everybody know that when the next live stream is. But I think this is a really good one because it comes up a lot, and even though it may not be something that one of your specialists focuses on, a lot of people have questions around naturopathic care in Mexico. And is it available? Like, are they going to be able to find maybe holistic doctors in Mexico? Maybe you can shine some light on that.
Short answer is yes. And a
Aside
lot of
from the
it,
curandero, like the curandero doesn't count.
well, a lot of people look at them as the alternative medicine realms.
Yeah.
Um, it's highly unregulated here in Mexico, and a lot of people do go to these alternative healthcare providers. You could get some of these sobadores or massagers, the sobadores who really have no formal training. I'll say that. Maybe it's a um, family profession, so to speak. Their grandpa, their grandma, and their parents were sobadores, and they'll go, for common ailments and to these massage therapists. Um, Chiropractic care here is available and it's gaining more recognition. It's also been highly unregulated up until recently. Ever since I arrived, there are more licensed healthcare providers, chiropractors. The other natural paths, again, this is very broad here. What constitutes it? It's a very loose term. People do tend to go to some certain certifications, which is maybe a 1 or 2 day course on supplements. And the way they make their money is they'll open a naturopathic pharmacy and sell these supplements. And, you know, they give you some orientation and
Mm-hmm.
consults on how to do how to take certain supplements. Like okay, you take such and such medication or supplement for a liver cleanse or detoxification, blah blah blah. And I know even here there's a naturopathic doctor that I guess you go and they have some contraption. You basically hold a couple levers and it gives you some readout on what ailments you may or may not have. And based on the readout from that machine, the naturopathic doctor, will then prescribe or recommend those supplements in their pharmacy for you. So
Interesting.
again, they don't have formal training. They have
Or,
such and such certificates from a lot of these loosely founded schools,
mhm.
but again, it's buyer beware, and you do your research before you go to the naturopaths. But I think their naturopathic doctors outnumber regular doctors here.
Yeah. Another beautiful thing about, in my opinion, and I've been treated in both the US hospital, I've been treated in a Mexican hospital. And in my opinion, in various different situations, one of the best things or the best reasons why people find that medical care is significantly better in Mexico is because the doctor really does take time to treat you as a whole. And not just, first of all, I feel like they make eye contact. So that's a big plus.
Mhm.
From comparison to how it is in the States, where you feel like you're in and out in 5 minutes and the doctor didn't even really look at you, they just looked at your chart. So that's also a really nice thing. And I feel like it goes a really long way because people want to be seen. Um, and that's just my own personal experience. I'm sure a lot of people have the same experience, right, Dr. Hernandez, and just the comparison between how medical care compares in Mexico versus other countries.
Correct. Well, one nice thing that we don't have here in Mexico is these astronomical costs for malpractice insurance.
Hmm.
In the United States, unfortunately, just to break even on a given day, like, by the numbers, we have to see at least 20, 30 patients a day. I know we were seeing some in one of the practices that I worked with out in Aurora. We were seeing upwards of 50 patients in an 8 to 10 hour period. I mean, that's giving each patient like 10 minutes. I do believe that most doctors who get into the profession, have the best intentions
Of course.
and want to provide adequate care. But then when they get out and into the profession and have to work, number one, they have to make a living. And number two, if they don't own their own businesses, they are partners in a group, a medical group, or a hospital. We have these meetings annually, these productivity meetings. Okay, so why aren't you seeing more patients? This, that, the other. So it's a lot of stress. And in Canada, where healthcare is quote unquote free,
Hmm.
I know a lot of my Canadian patients are very happy to pay for medical care here because when they go see their doctor, they literally have 10 minutes and only one question to address. If you have a second question, that constitutes you have to make um, another appointment. So they're very upset about that. So when a busy day for me is maybe 20 patients. On a normal day, I see between 10 to 12 patients, and I easily allot about a half hour to each consultation. You have to remember that expats generally still tend to be over the age of 60. People over the age of 60 tend to have at least three different diagnoses,
Mm.
and for each diagnosis, you have at least three problems. So that's nine problems we have to address in 30 minutes.
Yeah. Yeah. But it's just, I mean, I'm sorry, I apologize to anybody out there who's watching. I might be a doctor in the US or practicing in the US currently. I'm not bashing anybody. I know it's by design that way, and it's not. You wish it was different too.
Yeah.
Uh, yeah, no, I know this. It's not in any way a negative to them. I know it's just how the system is designed. But
Mhm.
well, thank you so much, Dr. Hernandez, for being here today. I really do appreciate your time. Again, I'm going to reiterate to everybody watching, Chapala Med's website is on the screen now, chapalamed.com. If you go to / about us, you'll read about Dr. Hernandez's background and more about the actual clinic. And if you want to go check them out on Facebook, it's facebook.com / Chapala Medical. Sorry, not Chapala Med, Chapala Medical. So please go find them on Facebook, give them a like. And yeah, if you have any questions, he's offered his email to you guys, info@chapalamed.com. So thank you again, Dr. Hernandez, for being here tonight.
Well, thank you very much for reaching out to me, and it's my pleasure to help in any way I can. For anybody looking to make that perspective jump, um, I see, the expat population is growing from day to day, and so the services that you guys provide, all the information is absolutely amazing. It's important, and I wish more of my patients would have stumbled upon your websites before they moved here. But it's a very valuable resource, and I'm happy and proud to be a part of this information that you provide.
Thank you so much. If you guys are wondering when the next live stream is, it's Saturday. So I'm having kind of an off schedule this week. I'm having, like, for example, today is 4 p.m. instead of 5. I have kind of a last minute live stream that I've scheduled this Saturday at 1 p.m. Central. For those of you who are wondering about the residency process in McAllen, Texas, because McAllen, Texas has the lowest income requirements of all the consulates in the US. You won't want to miss that live stream. I'm going to interview an expat who just got his temporary residency in McAllen, Texas. He's going to walk us through what McAllen required, and then you guys can ask him your questions in real time. But again, thank you, Dr. Hernandez, for being here tonight. And thank you guys so much for spending this evening with us.
All right. Thank you very much.
Hasta luego.
Adios.